educating us on exactly what the NDC's promise of free primary health care is all about. And I'm sure that for where we are now, I want to talk about the health workers. I know that you're one of them. How do you think this policy will benefit them?
In so many ways. Government of the NDC will never do away with the interest of health workers and workers in general. So more broadly, in terms of what we have for health workers, I can just run you through a few of them.
We have just 10 minutes.
1, implement tax waivers to assist health workers to acquire means of transport, that is, vehicles, so that they will be aided to respond to emergency calls. Establish a housing scheme for health workers and provide residential facilities at all health facilities for them so that they'll be closer to their workplace. So 2, 1 is more for them and the other is whilst they are in service so that they can benefit from it. And to make this possible, we are also saying that we will amend the National Pensions Act to allow health professionals who have contributed to SNIT for 10 years and above to collateralize their contributions for mortgage. And then revise and expand the definition of frontline workers. I mean, that became a major issue. We want to define it and harmonize it so that in pandemics, in emergencies, we will not shortchange anyone. Employ the backlog of all unemployed qualified health professionals. Sometimes you hear this.
I heard this morning, the national organizer was talking about how all these nurses have been employed. They didn't know what you guys were talking about.
Forget about it. They simply don't know what they are talking about. You and I are witnesses to the number of demonstrations that we have seen at the Ministry of Health. What are they referring to? Support health professionals with insurance to cushion them from unintended consequences of their practice. These days, people are becoming more and more enlightened, more and more aware of their rights. And so medical legal issues are popping up, and hospitals have to settle some of these things quietly. We need to support them so that they will get insurance, so that when those things happen, they can fall on the insurance to take care of them. Another thing is establish a Professor Jacob Planwu Endowment Fund for medical and surgical specialist training. People even complete after they have become specialists. Sometimes they need subspecialty. They may have to travel abroad. They need support. Some of them may fall on the GET fund. It doesn't really work too well for them. So this Professor Jacob Planwu Fund will support them immensely. And if we get to a COVID, I will relate to who Professor Jacob Planwu is. Okay. He's one of the medical martyrs who died sadly from COVID. Another thing is also to scale up training of physician assistants and emergency physicians. In this free primary health care program, we will need a lot of physician assistants. We will need a lot of midwives. We will need a lot of nurses. And of course, doctors will also be supporting, a pharmacist and all. What do I mean? Unlike the MPP that refused, stubbornness, refused to include private secondary schools in free SHS, which is what led to double track and the earlier congestion on campuses and all. We are saying that we will add private hospitals, private clinics at the district level to the free primary health care program. Because government alone doesn't have enough facilities to take care of Ghanaians. So we will add them to it.
On board.
Whilst adding them to it, we are creating more jobs because more people are coming to patronize their service. The next thing is that there are other places that we do not even have facility, neither government nor the private sector. Physician assistants, are they ready to set up? Midwives, are they ready to set up? Doctors, are they ready to set up? Government says, an NDC government, a future NDC government says, we will support you if you are ready to set up in such areas where neither government nor the existing private sector have a facility. We will support you. So you can imagine the number of jobs. And we have received a lot of calls for visa assistance because they are even already having some kind of challenges with their credentialing and all. And last but not least, we will also establish a National Health Workers Day that will recognize deserving health workers who have excelled in a particular year. And so you realize that with free primary health care, you are taking care of Ghanaians at the district hospital free, polyclinics free, all the way to Chief's compound. You are doing health promotion. You are doing prevention. You are also creating jobs for physician assistants, midwives, nurses, doctors, because they can establish more to take care of more Ghanaians.
They are being appreciated and celebrated also.
They are being appreciated and celebrated also. And in all, you are achieving health for all Ghanaians, which is the overarching goal, the vision that the NDC has when it comes to health. To provide health for every Ghanaian, whether you are poor or rich. You should not be denied health care by virtue of your socioeconomic status. This is why we are implementing free primary health care.
Because we don't have too much time, I want to talk about COVID.
Yeah.
The borders were closed, finally opened on the 1st of September. Arriving passengers are supposed to, or subjected to a mandatory COVID test at the cost of $150 per passenger. And I'm sure that you've seen all the brouhaha so far as the airports are concerned. Some arrived, didn't know that they had to get that test done. They were detained at the airports. Now we are told that it's mandatory. Wherever you're boarding, you need to pay before you arrive so that they won't have the situation that they've had earlier. In all of this, what do you make of it?
Obi, government was shambolic, terrible in their management of COVID-19. Look, I'll use two classic examples, then I'll come to the $150 issue. Look at the lockdown, how they implemented the relief items to Ghanaians who needed them. It was basically an issue of inviting them to be infected, jumping over themselves, and you ask, what will happen to the vulnerable? Pregnant women, people with disabilities and all. What will happen to them? In that kind of struggle, free-for-all struggle for food, how are they going to get that food? Contrast it with the way President Mahama delivered his social interventions during that same COVID period. He went knocking on doors, delivering them to the people, and in other cases, gave them to traditional authorities for them to deliver them to the vulnerable in those communities. President Mahama said it on countless occasions. Involve traditional authorities, involve the local authorities in this distribution. They wouldn't listen. This is one clear difference between President Mahama and the current administration. So I've used how they delivered the lockdown social intervention. That is one. Two is Professor Jacob Plangu, who we are naming the endowment fund for surgical and medical specialist training after. We were told by the president's advisor on health that they flew a presidential jet from Ghana to Kenya to bring a drug in. That means it went out and had to come in. The drug is an emergency drug that they needed at the time. It can also be used in non-emergencies. Let me clarify. So if at the time that it was an emergency and they needed it, wasn't it better to have gotten a flight that would have just come in one way than to fly a jet out and back? This is what should let you understand how this government thinks. You need a drug urgently to take care of a patient. You prefer to fly out back. Could you have gotten a flight that would have brought it in? That is one. Two, Roche has reps here in Ghana. Did they contact any of the Roche reps that they needed Atrema, tocilizumab, so urgently, and they said they didn't have it? You understand? So this is how they mismanage. I'm citing these two examples. I can cite so many of them. Look at even data. Let me add a third one. Data.
We have a minute to go.
How they mess up with data. Now you open borders and everything they want to profit from. You open borders and you are charging $150. When I tweeted about it, the first response was that, oh, this one is not an antibody test. And I said, look, PCR is not an antibody test. So whatever you are doing, I'm not saying that it's an antibody test. I think that they can do the test half the cost.
Why do you think
they are profiting from it? They should. You see, why do you want to profit from a pandemic?
And you think that's what they're doing?
Simple. They are profiting from the pandemic. This $150 test is inimical to the survival of the Ghanaian, because if they come in and they are unable to afford, what is going to happen? They may not come in, or they may fly to a different country if that country is charging less, may not even do it at all, and may sneak in. I think that it is not too late for the government to pull the brakes on this high $150 COVID test per person at the Kotoka International Airport and other MT4. Unfortunately, now they are saying that even before you come, pay it.
Pay there, yeah, sure.
So it means that usukrani eye no more. Usukrani eye no more.
Anyway,
why do you want to profit from coronavirus? So free primary healthcare is coming. Healthcare will be free at the district level.
Thank you very much, Dr. Omane Boama. Free primary healthcare will be the single largest social intervention under the Fourth Republic. Under the free primary healthcare plan, no Ghanaian will pay for healthcare in district hospitals, polyclinics, health centers, and community health planning services. That's the CHIPS compound. The exciting news about this policy is that individuals receiving healthcare in any of the primary health facilities will not need a national health insurance card to benefit from free primary healthcare. The free primary healthcare simply seeks to provide quality healthcare for all Ghanaians at no cost to the individual. And His Excellency John Dramani Mahama has demonstrated his unquenchable determination to implement it when voted into power come December 7th, 2020. In 54 days, you and I will have the unique opportunity to put this country back on the path of progress by voting for a leadership that works for all. Voting for a leadership that works for all is a vote for His Excellency John Dramani Mahama and the NDC. This is where we end the 10th edition of Minority Caucus. See you sometime next week on Joy News TV. Do have a pleasant evening. My name is Obobiata Kopoku, ably produced by Abna Babu and Yayira Koku. Thanks for your time. Good evening.